Hey guys, it's Claire, and I'm here to talk to you about eating disorders. What's an eating disorder, you may ask? Well, it's any psychological disorder characterized by unusual or disturbed eating habits.
Eating disorders can be caused by biological, social, and other psychological factors. Biological factors include neurotransmitter dysregulation, in which the levels of dopamine within the brain are not regulated, and then as a result, people cannot control what they want to eat or what they would refuse to eat. Also, there are psychological factors which may affect determine why someone would develop an eating disorder, such as childhood abuse, or sometimes if someone has an obsessive compulsive disorder, they may be more likely to develop an eating disorder. Oh, and also social factors such as the pro-Ana and pro-Mia websites, which promote anorexia and bulimia as a lifestyle rather than an unhealthy mental disorder.
Other aspects of social media and social factors such as Instagram, Facebook, or other social media can really influence the type of body people think they want. Like things such as thinspiration and whole trends with like thigh gaps, or I think there was something called the bridge. They really influence the type of body people think they want, and it really starts to alter people's perception of what their body is and what they need to do to get a more acceptable body type.
Anorexia include an overwhelming fear of weight gain, and people who are affected by anorexia typically will use laxatives or will restrict their diet so they can lose weight. And then they also commonly their self-worth is tied to their weight. So if they gain weight or they lose weight, it will affect their self-esteem. Oh, also potential medical indicators of anorexia include osteoporosis, constipation, lanugo, which is kind of like fine hair covering your entire body. So it's almost like fur, but it's usually blonde and it's very thin. Also, you could experience brain damage, a multiple organ failure, extremely low blood pressure, a slow pulse, a reduction in your body temperature, lethargy, brittle hair and nails, and then also anemia, which is a blood disorder where you don't have enough iron in your blood, and then also muscle weakness. Okay, there are also a series of mental conditions that are tied to anorexia, including depression, anxiety, personality disorder where you have multiple personalities, alcohol and substance abuse, and an obsessive compulsive disorder.
Bulimia nervosa is a serious, potentially life-threatening eating disorder characterized by a cycle of binging and then compensating behaviors such as purging, which are in different ways, such as self-induced vomiting, designed to undo or compensate for the binging that just occurred. Purging happens in 3 different ways, either through self-induced vomiting, laxative use, or excessive working out. Symptoms of bulimia include frequent binge eating, consuming large amounts of food, and then followed by the purging behaviors to prevent weight gain. Purging happens in I just said that, okay. Mental disorders associated with eating disorders such as we saw with anorexia include depression, social isolation, anxiety, and having disordered or excessively negative body images where you think you look a certain way. Like if you were to look into a mirror, you think you look a certain way, but you really don't. So someone who is extremely skinny, even like life-threateningly so, might think they're morbidly obese, and it creates a very negative body image, and it can become extremely dangerous over time. And they become very preoccupied with their body shape and weight. If you're concerned someone has bulimia, they might have developed some warning signs such as wrappers hidden because they don't like to show what they have binged. They have a lot of shame of what they have binged previously. Evidence of purging behaviors such as going to the bathroom immediately after eating. They have an excessive or rigid exercise regimen, like where they'll go on a run for like 2 miles even if it's raining outside or even if the weather's awful. Discoloration or staining of the teeth to show that purging behaviors such as self-induced vomiting have occurred. Also, if someone has cuts or scrapes on the back of their hand, that can show that they have tried to use self-induced vomiting to prevent that kind of stuff. Certain health effects that are associated with bulimia include electrolyte imbalances that can lead to irregular heartbeats and possible heart failure and death. The electrolyte imbalance is caused by dehydration from loss of potassium and sodium in the body as a result of the purging behaviors. Inflammation and possible rupture of the esophagus from frequent vomiting is also a possibility. Also, you can rupture your stomach from having excessive binging behaviors and then soon compensating for that. Tooth decay and staining of the teeth is a major concern. Tooth decay and staining of the teeth is a very common side effect of self-induced vomiting. Chronic irregular bowel movements and constipation are a very common side effect of excessive laxative use. So if someone goes through excessive laxative use in order to compensate for what they eat, that is a very likely side effect. Gastric rupture is an uncommon but very possible side effect of binge eating. You put severe stress on your body if you... Your heart is not built to handle everyday or regular use of laxatives or vomiting. This type of stress may cause a thing called arrhythmia, heart palpitation, heart attacks, or even death. Bulimia may cause gastroparesis, a partial paralyzation of your stomach muscles, meaning you won't be able to digest something if you do eat something. Two types of bulimia exist. Bulimia, the purging type, which is the type of bulimia that accounts for a majority of the cases from the people suffering of the eating disorder. In this form, individuals will regularly engage in self-induced vomiting or abuse of laxatives, diuretics, enemas after periods of binging. There's a non-purging type, which in this form of bulimia, though it is less common, the individual will use inappropriate amounts of compensation for the binging that has occurred, such as excessive fasting or exercising. In these cases, the typical forms of purging, such as self-induced vomiting, are not regularly utilized.
There you go. All right, so binge eating disorder. A person with binge eating disorder will start eating and feel completely out of control once they start, as if they want to stop, but they just physically cannot stop. Their binges are as often as once a week per 3 months, and they go on binges much like someone with bulimia would, but they don't go through the purge cycle afterwards. Binge eating disorder, or BED, is also known as compulsive overeating, emotional eating, or a food addiction. Some characteristics of binge eating disorder are eating until uncomfortably full, like very uncomfortably full, eating when not hungry, eating large amounts of food in a very short period of time, eating in private due to embarrassment about how much you're eating, feeling depressed, guilty, ashamed, or disgusted after going on a binge, and feelings of extreme self-hatred because of your eating disorders. The causes of BED can be similar to the other two eating disorders. Like impulsivity dysregulation is reduced activity in the part of your brain that controls impulses, which controls what you want and don't want and messes with that. Or a neurotransmitter dysregulation is an imbalance in the dopamine signals in your brain telling you also what you want and what you don't want. Genetic influences can play a part in it too. It can be carried through the genes from your mom or your dad. Or social influences, like seeing media, seeing what like models look like, that can play a big part in eating disorder. As you can see, all three eating disorders are kind of connected and aligned. Like anorexia will involve purging, kind of like bulimia, but without the binge. And binge eating disorder will include the binging like bulimia, but without the purging.
People affected with an eating disorder may receive a variety of treatments depending upon their age and also the severity of their eating disorder. Treatments for an eating disorder include hospitalization due to heart problems, dehydration, electrolyte imbalance, or a psychological instability, and also potentially suicidal thoughts at the time. It also, when you're in the hospital, you may also require a nasogastric tube to administer nutrients and food directly into your stomach acid if you are in a life-threatening situation. However, other treatments that may include just a dietary plan to restore lost weight and family involvement, where this is usually applied to younger victims of anorexia, bulimia, or binge eating, where they personally cannot control their urges or their desire to restrict what they are consuming. Also, many people who are affected with an eating disorder go through psychological therapy. Younger victims of anorexia, bulimia, or binge eating disorder will usually have family-based therapy where they'll have a parent or other siblings involved to help them through the process. But adults usually have individual therapy with a counselor that they meet once a week.